I know we're here to talk about small business, and I want to do that. But there really are some amazingly important things happening, as John indicated. A couple days before I came out Saturday morning, or it was on Thursday, at a breakfast, a man said he didn't believe in miracles until he realized this healthcare bill allowed his teenage daughter to be insured. She had a disease. They didn't have insurance. Every day of their lives was one trying to make sure they had enough money to take care of the emergency room visits for their little girl. She became a bigger thing, and now she has health insurance. So my friend Bob's believes in miracles. These stories are all over America today. If we just took that one piece of legislation, one piece of our legislation that stops the insurance companies from denying coverage for pre-existing disability, you could fill a big book. But we've done more. We've moved on to setting up programs in every state so that people who have disabilities to their bodies, if they don't have insurance for 6 months and some other conditions, they also can be insured. This is an important piece of legislation. And it is not a partisan piece of legislation. I don't know who asks when someone comes to the doctor or hospital, what's your political affiliation? It doesn't matter. People who have diabetes are Democrats and Republicans. But as Bob said, no one is concerned about that when you have a child that's sick and you can't get insurance. This is an issue that is extremely important for everyone in America today. I have pretty good insurance. I'm a federal employee. I have the same insurance that someone who works for the FBI has, or the Bureau of Land Management. And basically, that was the goal of what we were trying to do, is to make sure that people have the opportunity in the years to come to have insurance comparable to what I have, or what Herb has. He's a federal employee. That's what this insurance program, this Healthcare Improvement Act is all about. But in addition to that, we wanted to make sure that we could do something to have people understand that it applies not only to individuals but to businesses, and small businesses is made up of individuals. You see, when someone doesn't have insurance and they get sick or injured and go to an emergency room, it's the most expensive care any place in America. And who pays for that? Someone pays for it. We do. In the form of higher insurance premiums, higher hospital and doctor bills, higher income taxes. So the payments there is usually a very expensive plan. Most jobs in this country don't come from General Motors or General Electric. They come from businesses like Susan's, and they come from businesses like Ron. More than 80% of the jobs in America are today and always have been small businesses. And they have been hamstrung by insurance companies. And the people who offered health insurance has dropped significantly in the last 15 years. Why? Couldn't afford it. Just too expensive. And now we have programs that allow small businesses to have health insurance. And that's where we're going today to talk about this. We know that this healthcare bill, we should do a better job of conveying to small businesses the opportunities they have. We've mailed to 44 million small businesses. And like all mail, everybody thinks it's a piece of junk mail and throw it away. But it's there, and we're doing everything we can, and we ought to do a lot more to make sure, as John indicated, small businesses know about this. Because once they know about it, they're willing to be involved in it, rightfully so, because it's good for their business and good for their employees. I remind everyone, as I started, healthcare is not a partisan issue. It's an issue that affects everyone in America today. It is so difficult when someone is sick and hurt and has no place to turn. We want to make sure that they do have a place to turn. So we'll take some questions now.
What are you going to do differently going forward to ensure that the small businesses will get this message?
We are doing a a lot of outreach. The Secretary of Health and Human Services, Catherine Sebelius, knows this is one of her prime responsibilities. That's why she's focused on Region 9 and every region to make sure that they do get this information. Ron has jurisdiction here, I'm sorry, Ron, Herb has jurisdiction of 335 region 9 alone. So it's not an easy task. A lot of small businesses here in Nevada, they receive these meetings like everyone else. It's so fascinating. Once people know about this, they're able to get insurance. I'm told Bird, John, Ron, and Susan, and before they're coming out here, an experience I had the other night at the Larry Rubo big dinner, raising money for his brain institute. The wife of his surgeon, who was badly injured in a skiing accident, did not know that this health insurance was available to her employees. She has less than 10 employees and make less than $25,000 a year average. She qualifies for 35% tax credit, 35%. And all you have to do is explain this to people and they jump at it. She now has all 10 of her employees insured.
Senator, it's no secret that Nevada leads the nation when it comes to people walking around without insurance. Do you feel that this bill, this law has helped bring that number down?
We have a lot of distinctions here in Nevada that I'm not really happy about. Like the 50th in the nation for state contribution to education, and of course, most uninsured. We are confident, I am confident that this is going to help Nevada and every other place. We just have to do a better job of getting the information out. Remember, the bill just passed a year ago. The exchanges don't kick in until 2014. The law is phased in different increments. A few months ago kicked in, senior citizens now can go get wellness checks for nothing. So people are learning about this more every day, and we're doing our best to keep people informed. Yes, we will have the vaccine. Thank you very much, everyone. Glad to be home.